So I'd like to invite Dr. Nikki Partridge to come up for any Q&A. We do have some online first, and then again, we have our microphone runners out there. So Michelle, go ahead.
Oh, let her get to the microphone.
Thank you. I just want to thank Patty and Michelle for inviting us here to present this work. Bijou couldn't be here. He has a small baby, and he's very involved with her care. And so he's the AAV expert, and I'm the basic science parathyroid hormone bone person. I'll answer questions as best I can. So what questions do you have?
So the first question out the gate that we have online is, if I am post-surgical, and so my genes weren't damaged to begin with, would this kind of therapy still help me?
Yes, absolutely. And I mean, he gave a very big overview about gene therapy, but we're talking about here actually providing parathyroid hormone. So it's not actually going in and replacing a gene in the what might be left of the parathyroid gland or something. It's providing parathyroid hormone. The AAV would go to the liver, and then it would and then the liver cells would make the parathyroid hormone. So it's not actually replacing a gene. It would be definitely available for post-surgical patients.
That makes a lot more sense, that it's generating the hormone, not a gene replacement.
Yes.
Okay, then this question is kind of related, but let's see if it generates a different answer. This patient is actually asking, would this type of therapy work for someone who was born without parathyroid glands? I think the answer
I
would
would
be the
say
same.
yes. Yes, I think it would as well, yes.
Do we have any in the audience? I have one more, but if we don't.
Well, let's go over here to Katie and Caroline.
Hi, I was curious, with the synthetic promoter switches, would you be able to create a collection of switches that would allow you to select what calcium range you would like to have?
Bijou's looking into this now. They're trying to develop a calcium sensing promoter.
Because different patients need different levels.
That might be a possibility
And
down the
so-
road. Yeah, I mean, he's used now several different sorts of promoters, and yeah, I think that could be something.
Yeah. If you're
down the
not
road,
already, could you look into it?
Sorry, what?
If you haven't already, have him look into it,
It'll
because
be-
everybody kind of has their own happy place, is kind of how I refer to it, where some people are super happy at 8.5, others need like mid-9s, and so being able to select the level that you're promoting to would be amazing.
Okay, I'll take that back to him.
All right, Michelle.
I think this might be along the same lines, but I'm going to honestly say this question is a little above my head. It says, have you already identified promoters which allow completely turning off the modified genes rather than just partially reducing expression?
I'm not sure that that's relevant to what we're saying here. That was about switching them off, whereas we're trying to, say, switch them on, and to do it in, say, a circadian rhythm, or in a response to calcium, or by his mechanical system. It's not about actually switching them off.
Okay.
Any other questions? Katie, go up front here. Up here. Here. Josh.
All right, this may be a loaded question, but okay, so I have GATA3 HDR syndrome. If I'm understanding correctly, this type of therapy probably wouldn't work unless that gene is actually fixed. Am I right on that?
Yes, what we're proposing, but there may be down the road something that could be done using this type of technology. I mean, as he said in his talk, there's like 100 systems available now, and 1,500 or so in review. There are many gene modifications that are being treated with AAV.
Okay, we have a question in the back.
I think I read recently that they used something similar to this to fix AIDS.
Sorry, you're right under the light. So,
Hi, I'm Liz. Didn't they recently use technology similar to this to cure AIDS? They found how they could change the sequencing. And I'm just wondering how that, because most people know about AIDS, if that's going to throw money in this direction and help them come up with even more cures faster. And then my other question is, what if they give you this one-time dose and it works, but then they find some very negative side effects? Could they give you like some antidote to it, or like what happens then?
I don't know about that, but I mean, there's some cases they've had some inflammation and then they've given prednisone at the time of injection. That's what some of the studies have shown with the early uses of AAV. But obviously there would have to be a tremendous amount of work done before this could actually be used in the way that we're suggesting.
Okay, is that it? All right, well, thank you very much.
Thank you very much.
All righty, so